Time to Ask the Dentist. Dr. Kristen Simpson with Simpson Dental Associates, the dental office, joins us now. And if you have a question for Dr. Simpson, here's a number. It's 877-924-7888. So until we get our first call, Dr. Simpson,
Yes.
How do you know if you need to replace an old crown?
Yes, that's a good question. A lot of people wonder, my older crown looks like it might be gray underneath. A lot of advances have been made in dentistry to where we have newer materials now to make crowns blend into your smile a lot better, especially if it's on a front tooth. That metal underneath can start to turn the tooth kind of gray, and that might be an indicator that it's time to have that crown replaced. If the crown's chipped, you should definitely have it replaced. Or if there's decay, you can still get decay around a crown. They are susceptible to cavities right at the gum line. So it is important to still maintain, your 6-month cleaning appointments and still keeping up with your brushing and flossing just like you do with natural teeth.
Well, let's say you do have a tooth that looks a little gray.
Yes.
Does that necessarily mean it has a cavity?
Actually what that can be is, sometimes you can have an older silver filling that could be leaking, and a lot of times those silver fillings will turn the tooth gray. So it is good to have that filling replaced. If it's a smaller filling, it might just be able to be replaced with like a composite filling, but if it's a larger one, it might need a crown on the tooth.
All right, we have our first caller. Tad is on the line. What's your question? Welcome to Ask the Dentist.
Yes, I'm wondering if you could give me a rough idea what it would cost to do the one-day thing with the pins and dentures and so on.
Okay, yes. Well, I think you're talking about the teeth in a day, and that's where we place 4 implants on the bottom arch and use those implants to connect a denture to. It helps to stabilize the lower denture. Normally a lower denture is the one that has the most movement, so that's why, we recommend that. There are lots of things that can change the price of that. Depending on how much bone you have in the area, you might need some grafting. We need to make sure that you can have the 4 implants. We need to know the type of implants to use in your mouth. So, there are lots of variable pricings, and, depending on what type of denture we make. There are several different types of teeth that we can use in the dentures, different, plastics and, acrylics that we can use. So, really we just need to take a look at you, take a CT scan so that we can get a 3-dimensional image of everything so we know how much bone height and width there is.
Right.
And then we can get some plans together. So,
I have a quick question for you. How do you know what kind of toothbrush to use? Because you hear, tough, hard bristles are good.
Right.
And then sometimes you hear people saying, no, you should go for the softer ones because, it's easier on the gum line. What's your take on that?
I definitely would say a soft bristle toothbrush is best. You don't need a hard bristled brush. If you use that, it'll cause more recession. So really the softer toothbrushes are great. They do a good job. Just make sure you're angling it down towards the gum line to get the plaque that's along the gums there. And a lot of times using a powered toothbrush is great too. There are all kinds of varieties of toothbrushes. So, really you can change it up and figure out what works best for you, but as long as you're doing it.
That's the important thing. There's so many toothbrushes, just like there are different kinds of toothpaste.
Exactly.
What's the best kind of toothpaste?
Well, you just want to make sure that you have toothpaste that has fluoride in it. And other than that, really that's all that matters,
So is a sparkling white and extra cavity protection, it's basically all the same?
It is, yeah. Basically what it does is just kind of freshens your breath. Really, it's the mechanical action of brushing that gets rid of the plaque that's along the gum lines. So you can even use a dry toothbrush, and that'll be enough to get rid of the plaque there.
Also brush the tongue.
Yes.
That helps with halitosis.
Right, that's right.
All right. Thanks so much. Appreciate it, Dr. Simpson. Well, we're going to tell you what movie is #1 at the box office and why Sean Penn